I all hope each and everyone is doing well and good. And today we are going to discuss about a pediatric, the most important topic because so many of them messaged me that they want questions. And pediatrics is going to be the scoring subject always. Please don't skip it. And this is one of the very interesting subject to learn as well as. So yes, I'm going to say about so fast about the important topics. So if you're planning to revise or if you're planning to start with pediatrics, yes, guys, always start with first thing is torch infection is going to be very important because in torch infections you already know that CME voila how many times they have been asked in the examination because as much important every year there is a question. So start with pediatrics, this torch infections where you see that periventricular calcification, all time favorite CMV, toxoplasmosis, also learn it's very important, varicella and all those things, that what are the congenital rubella syndrome, very important, congenital toxoplasmosis, CME, very important, always favorite, herpes zoster, Zika virus, congenital syphilis, please never skip it. So after learning that, next important is neonatal resuscitation, very important because all those steps, how do you give, that's all things they can ask, that what is this thing, how is that, there is a beautiful algorithm in your standard textbook, please do learn it. All those steps are very important, and after learning that go to milestones because every time you get a question from milestone, very important, all those things you must learn, that fine motor, social language and everything, because they can ask like when the child say like this waves bye bye, and all those things, when does the stranger anxiety, when that like looks at the mirror and the smile, that's all time favorite, please learn that box, very important. And also the genetic disorders, just read and go. So after that then go with again infection, acute epiglottitis and antibiotics. No, so antibiotics is choice in epiglottitis group. What you do is you give steroids as well as this adrenaline nebulization and all those things, please, very important. Neural tube defect, that's all thing, yeah, you again learn it with gynec, please learn it. So after that very important is malnutrition is very important, that is Kwashiorkor marasmus, that table in and out, where do you see in that flag sign, that's all very important. And also SAM, that is severe acute malnutrition, that where do you like that there is a cutoff, voila, very important, where do you that severe wasting and that acute this thing now, acute weight by height. And where is, what about chronic is what, height for age, that is high is for chronic, that's all thing, all time favorite, please never ever skip it. And that table voila, that all things, all time favorite is hypophosphatemia and all those things now, that F100, F75 and all those things, in and out, please learn. See what are the triad, like infection, hypoglycemia, hypothermia, that's acute malnutrition, very important. I hope you got that table thing, very important. So in and out, you want to the management and all those things. So after that, yes, a vitamin A, voila, just read and go. And also this dehydration, very important, that's plan A, plan B, plan C, they will give a clinical scenario and they will ask you, very important. And also in 2023 they have asked a question, this thing, that is type diabetes mellitus, type 1 DM, how do you manage as well as the diabetes ketoacidosis in children, what is that, like this thing, that's just given in your OPK book, please learn it. As well as this, very important. Then important is, yeah, diarrhea I have already mentioned, how you treat, like plan A, plan B, plan C, in and out. As well as what about the difference between this WHORS and Brisomol and all those things. Vitamin A, that class very important, that's vitamin A wala, that table na, 10x, that is corneal ulcer, 10-1B, where what is that, bitter spot and all those things, very important, please never skip it. And all those things, HSP wala and all things, that is very important, where do you like abdomen pain, IgA, hematuria, palpable pulpuria, where do you see, what is the diagnosis, HSP, very important, IgA deposits we will be seeing, Turner syndrome, just read and go. Post streptococcal glomerulonephritis, that nephritis, nephrotic syndrome, the management, the drugs, very important. As well as that minimal change disease, very important, effacement of the podocyte, edema, massive proteinuria in the child, what is the diagnosis, this is minimal change disease, very important. And also that seizure voila and the drug, that's absent seizure, how do you identify, like in EEG, what is that, 3 hertz spike and wave pattern, and what is the drug, ethosuximide, very important. Like that in tuberous sclerosis, what is the drug, where do you give that, vigabarin, very important. important. That's seizure viola, please don't skip it. And yes, that's hypoglycemia, hemorrhagic disease of the newborn. Why you give vitamin K at birth? Very important. That's all thing important. Yeah, vaccines not following open vial policy, very important. That is at BCG, measles, rota, JE. That is very important. Yellow fever. Well, I just read and go. And yeah, breast milk, very important. Breast, how do you do that breastfeeding? Breastfeeding. Voila, there is a like steps and all. That's very important because INA this time they have been asked. Very important that steps. And that preterm, that is Palada thing and all those things very important. And all reflects that parachute, moros reflects, that's all going to be important. Just read and go. So yes, pediatrics is going to be very easy. At the same time, yes, please learn it. And this was a very short video, and all the best for everybody. Thank you for watching me. Thank you all.